Hello, this is Brighter Futures, the film series about how ideas improve lives and change policy. It's a great pleasure to welcome Wayne Martin from the School of Philosophy and Art History. Wayne, you, as a philosopher, set up and helped set up with others the Essex Autonomy Project, which was using ideas on philosophy and human rights and capabilities of individuals and putting them in the space for social care, for change in that kind of way. Tell us a little bit about how the Essex Autonomy Project has worked and helped people.
Good. Well, thank you, Jules. It's a pleasure to join you on your latest endeavor here. So autonomy is one of those notions. It's everywhere. You think about what's happening in Ukraine right now. Ukraine is fighting for autonomy, right? To be able to set their own rules and live by their own rules. Autonomos. Greek concept. Originally political, about a city-state or a nation setting their own laws, not having their laws imposed from outside, but over the course of a couple of millennia, increasingly one that we apply to individuals as well. We want autonomy. What that means exactly, what are the limits of that, how you balance that against other priorities, these are really hard questions. But it's one that comes up a lot in policy. And the kind of latest frontier in that has been to think about how you embed ideals of autonomy in care settings and in the practices, the vocations of care. So health care, elder care, psychiatric care, and so on. Traditionally, those are zones where there's not a lot of autonomy. You think about disability or psychiatric illness, you do what you're told. You might get detained. You don't get to consent or not consent. But increasingly, we're trying collectively, I think, as a society, to think seriously about what it means to respect autonomy in those settings. And that's a policy challenge, that's a research challenge, and that's where we've been working for the last, I've kind of lost track now, 13 years maybe, in this zone in a very interdisciplinary, multidisciplinary way.
So you've taken these ideas that are kind of deeply embedded in human culture, as you said, over millennia, into specific contexts at the moment, and you've been in hospitals, in social care settings, observing how these things have happened. What would you say that you've seen that works and doesn't work, in a sense, in those kind of contexts? Presumably we're hoping that things get better in some sort of way by the application of these ideas.
Yeah, well, it's a great question, and I don't think there's any one answer. It's going to depend a lot on the context. So, for example, we did a lot of work in partnership with care homes that were locked down during the pandemic. So, very significant restrictions on autonomy. Of course, we were also locked down, although in a different way. So one of the challenges there is I've got these health objectives. I want to prevent the spread of this disease, but I also want to respect the autonomy of people who may not really understand very well what's going on or may not have those abilities. So there were definitely some mistakes that were made, and I think we learned from those. We were very actively involved in working with policy development in that zone. One thing that we know doesn't work very well is saying no visitors at all. That was what happened. You remember all those pictures, people peering through the windows to people who might have cognitive disabilities or sensory disabilities. That was really a self-defeating practice. For many people. And it also removed from that setting people who were the eyes and ears and oftentimes the best interpreters of what was going on. So that was something where we learned a lesson during the pandemic. We did our small bit there in trying to gather some real data. How do you even get data about what's going on inside one of those settings? We developed some techniques for that, and policy changed. Working with Parliament there, the Joint Committee on Human Rights issued a statement about that really changed practice. So there's both an example there about what doesn't work and then ways in which things do get better.
And so these are contexts with ill, marginalized, disabled people very often who are unable to do many of the things that one would take to be kind of norms in society. How then do you see the priorities in changing the kind of structures of care and support, both for the long term and also the short term? How did they translate those ideas to help people? Is it helping to organise them more? helping to change the people who staff and run these kind of organisations, both in the public and the private sectors?
Yeah.
Probably all of those things.
Yes,
again.
exactly.
Yeah.
Well, again, no one strategy is going to work. It has to be multi-pronged. One of the approaches we adopted early on was train the trainers, right? You've got a huge workforce, actually not large enough, we're learning at the moment. We definitely need improved staffing in all of these settings in the care sector. Those staff need training. Both training, initially, we do that here at the university in the School of Health and Social Care. We're involved in that increasingly too, but also then continuing professional development. We obviously, can't train all those people, but if you can find the people who train the trainers, then you can really, curriculum development, that sort of thing. We've been doing a lot of that work. It's hugely satisfying work. You're working with people who have huge workloads, who are navigating real hard ethical problems in real time, who often don't have time to stop and reflect about those things. And it's just a wonderful opportunity to work through those things and think about how things can get better in that way. I also think, increasingly we've been working globally. I spent part of this summer in Japan and then in Geneva at the UN working with a Japanese NGO that was interacting with the UN in terms of their human rights review. And these vulnerable people, marginalized people you're talking about, Jules, historically, they have been rendered invisible.
Yeah.
But they've been rendered invisible in different ways in different settings. So in Japan, they were historically really held within the family, not let out of the house, right? That was a family matter that you took care of there. Here in the UK, build large institutions,
Yes.
right? We had a very different history, and so people get invisibilized, if that's a word, inside large institutions as well. So those present very different historical circumstances, very different political challenges. But the issue about recognition, where I mean both just being able to see these people, to know them, to get to know them, but then also legally to recognize them, to get all of the things that we take for granted in being recognized as citizens, as being able to sign a contract, to instruct a solicitor to vote, these sorts of things. How do you achieve? That's one of the key challenges here. How do you achieve recognition in that legal sense for this kind of very diverse and vulnerable population? For that, you need to do more than train the trainers. You've got to change the law.
Yes. So take us into the mind of the kind of the context when you're talking to a select committee or a UN committee or as you're saying, dealing with human rights in London, and you're giving evidence, as it were, which is a way of helping to influence, you hope, policymakers. Take us into that kind of context. Does that feel like it's effective, it's working a bit, that people are listening, that it might change, or a bit dispiriting at times? One kind of hopes for change to be faster or more significant.
Some of each, I think, and I think this is an issue actually for us as an institution and the institution of the research community more broadly. We have our own sort of standards of evidence. What counts as a decisive proof? What counts as a decisive refutation? What counts as good evidence and bad evidence? And actually, those are very discipline-specific, too, often.
Very.
But if you really want to influence policy, you've got to figure out what is the form of evidence that meets the needs of that policy-making body. And typically, it's not just one body, because I've got to convince you, for instance, at the Ministry of Justice or the Department of Health and Social Care, but then you've got to go on and compete at Treasury
for some resources to do those things.
Exactly.
Yeah.
So what's the form of evidence that, and so some of the most discouraging moments in that kind of policy development work for me personally have been where I know there's all this evidence out there, for example, strategies to reduce coercion in psychiatric settings. I've seen all these pilot studies, things that work. I've heard the participants, both the patients, the family members, the people who are delivering the care. This stuff works. And then you get the Treasury assessment and they say, poor evidence. And so we can't,
not enough economic benefit.
We can't invest in this? Well, they're not just interested in economic benefit, but it's what counts as compelling evidence to show this is where we should be spending our money. So that's an ongoing strategy. You got to figure out how to design the research in a way that will produce the kind of evidence that will then meet the needs of the research consuming part of the policy world.
So when we're in periods of significant social, economic, environmental change that looks a lot like it's kind of at the bottom, heading towards the bottom for many people, things may well have got worse. We're in kind of collapse context, some would say. Do you feel as though that evidence of where things are working can be deployed in ways to give people hope for the future, that things can be better? Because if we don't have the hope, then we stop trying a little bit, and we might give up. I'm using a big we there, and again, you can't generalize. But I guess I'm saying, from the work that you've done, are you kind of optimistic that further improvements to people's lives continue to be made? Or what would you say are major gaps?
I guess in some ways, to me, it's not about being optimistic or pessimistic. It's about being determined, Maybe I do feel, this is the Brighter Futures series, and so I don't want to be too dark, but I do think let's put it this way, there's good reason to believe we're heading for a very, very difficult period here. Locally, nationally, globally, it's a very challenging time. And so, there are different ways to respond to that. And so, even if it is maybe a downward slope, how steep is it? And where are the places that we can find some uplift? But I have to say, in my particular world, of both research and activism and policy development, there are lots of really positive things happening. I feel like in some ways I'm out of sync with my colleagues, for example, elsewhere in the research community around human rights. Things are really dark in lots of places, but around this challenge of achieving recognition for these historically marginalized, vulnerable groups, wow, incredibly exciting things are happening. And partly that's because the global community came together at the UN level, 2006. We had the Convention on the Rights of Persons with Disabilities. That presented a huge challenge to nations. They made these promises, and now, okay, how are we going to keep those?
Measure those,
and then it's really fascinating to see now, a decade more on, the way in which different nations are adopting different. It's not one size fits all. So some places are taking really radical steps, for example, in Latin America, abolishing guardianships, for example. Other places are taking more modest steps. In Asia, it's a very different equation, and the historical setting is different. But anyway, there's a common determination there to find ways of making a more inclusive regimes of legal recognition. And that's a place where it's a very exciting time to be working.
So as a philosopher, you're thinking about these things, but you're also active in trying to change them in various ways. Is that a kind of reasonable definition of philosophy from your perspective?
Yeah, it's interesting. So my background is very much a philosopher, and I did not start out working in applied ethics or those sorts of areas at all. I was, working 20 years ago really on the theory of judgment and decision making in a philosophical way. And then here in the UK, one of the things I love about the UK, and here at Essex, there's this multidisciplinary kind of conversation, and you find out about places where, hey, we need some help thinking about this. So I came to this as a philosopher. Some of the things I do maybe not all that philosophical. I've been learning a lot about, DNA CPR forms. These are technical questions that have to be addressed. But actually, one of the things you find is that there are really deep philosophical questions in this area. I'll just name one of them. In order to recognize you as a citizen with full legal capacity, a player in civil society, I need to be able to attribute to you a will in certain matters. That might be a will in the sense of a last will and testament. This is what I want to do with my property after my death. It might be the will, I want to enter into a contract. This is what I want to achieve. This is my intention in this contract. I want a mobile phone, right? So now I need to enter into a relationship with a commercial provider to do that. That concept of the will That's one of these philosophical concepts. We've been debating about that for thousands of years. And there's a lot of really, actually research from philosophy that can be put into this zone. So a person, historically, people who have serious cognitive impairments, brain injuries, and so on, they're not recognized as having a will. But with techniques of support, with forms of kind of what we call cognitive outsourcing or offloading, in sharing out relationships, the hard work of figuring stuff out, together in partnership, one might be able to have a will and have a recognized will. So now, where before somebody else just made those decisions for me, now I can make them
You've got a space
for
for
myself.
engagement, yeah, exactly. Well, Wayne Martin, thank you very much indeed. You've been watching a Brighter Futures film about how ideas improve lives. If you'd like to hear more on conversations on these topics, pop over to our sister podcast, Louder Than Words.